Blue Cross ambulance.
It's 8 a.m. and the Blue Cross Animal Ambulance Service
What's going on with Scruffy?
is rushing a patient for urgent treatment.
Is he still eating and drinking?
Drivers Sonia and Angela are prepared for anything.
Oh, Frank's given a gift. Ooh. Oh, that's a bad one. I hope that's just a fart.
I don't think it will be.
And at two of Britain's busiest animal A&E departments, Blue Cross staff and volunteers
I'm sorry, I'm holding a puppy. I can't do anything. Stop it.
work round the clock to quickly diagnose and treat more than 19,000 animals a year.
Can you go to an emergency, Southwest 11?
Through the A&E doors comes everything from sore paws
He's done some serious damage.
to life-threatening injuries and those more embarrassing illnesses.
It's the anal gland smell.
We have wee.
And no 2 days are ever the same.
Oh, it's lovely. It's just the worst job ever.
At least I've not got pooed on just yet.
Frank is a 50-kilo Dog de Bordeaux with a bedwetting problem. The charity's ambulance is a lifeline for pet lovers unable to travel to the hospital. Frank's worried owner has called, concerned his wet sheets are a symptom of a more serious problem.
Oh,
Incontinence can be a sign of spinal injury or neurological disease, so vets need to get to the bottom of the problem.
Good afternoon, Blue Cross Victoria. How can I help?
This is the world's oldest animal hospital, where the charity's staff work 24/7,
Good boy.
treating animals of all shapes and sizes.
Any news on phone overnight?
No, doing absolutely fine. We see dogs that look like small horses. It makes it really challenging. Just moving a 60-kilo dog from one table to another, it's quite difficult.
Vet Christina is on a mission to solve Big Dog Frank's medical mystery. First, she needs to rule out the most common causes, like urine infection.
Come on, babe. Stand up. Come on. Look.
And that means she needs a wee sample. Frank, it seems, is only too happy to oblige.
Oh. We have a wee.
Okay. We might need an extra pair of hands, actually.
You free for a second?
Yeah, what's up?
Just gonna sedate Frank, but he's massive.
Christina needs to look at Frank's bladder, and that means putting him to sleep.
Good boy. You're getting sleepy.
That's okay.
Good boy.
1, 2, 3.
I'm not ready. Oh my god. Oh, sorry, it's really big.
Dog.
Yeah.
Okay. 2, 3. Oh boy. Oh, you're a big boy. We are not really allowed to lift up animals that are over 15 kilos. And if we have to do this every single day, we end up with a lot of back problems. So we'd rather just share the weight. His bladder is now very empty. So we take a first x-ray and see what it's like. Yeah, so that's the bladder here. I cannot see any bladder stones, anything that I would be worried about.
With no obvious answers, Christina needs to make a fast, accurate diagnosis before Frank deteriorates further. So it's back onto the trolley for one final test.
Blue Cross Grimsby, how can I help? Dog with the best name on here. Schmullick. Smullick, Smullick, Smullick. There's a cat that comes in called Dave. I like that.
Elvis?
Yeah.
What else have we had? Oh, I remember one. Yesterday there was a puppy basset hound called Shirley Bassett.
Yeah.
I thought that was hilarious. Hello.
Have you got King Kong's prescription, please?
What's it, Jackson, please?
The Blue Cross Hospital in Grimsby is one of the biggest in the north, treating 7,000 of our poorly pets a year.
How about this tree, Bandit?
The charity relies on volunteers.
We have wee.
Here, more than 30 do everything from puppy cuddling.
People call her a sausage dog, but she's a proper dasher. Proper dasher. Lots of love.
To cleaning up little accidents.
There's a method, because you go from side to side, and side to side, and side to side. When you retire, you know, you have to find other things in your life. Sometimes if there's a good record on, we go, it's music. And I came straight down here. And I said, one thing I can guarantee is that I may be a little bit late sometimes, but I'm reliable. So she said, start on Monday. Best exercise in the world. Better than a Zumba class.
Today, Helen has an important and delicate job. Nearly 300 strays
Hello, sweetie.
are brought into the hospital each year by members of the public. At a few days old, kittens like Oliver are still deaf, blind, and unable to perform even the simplest bodily functions.
This is Oliver, and he is quite labour-intensive at the moment because he needs feeding every couple of hours. We call animals all sorts of names when they come near, but I think it's because Oliver was always hungry, you know, so that seems appropriate because he's always ready to eat, which is really good. We have to look after him as though his mum is watching over him. So what she will do, she will lick him and she will top and tail him. So that's what we have to do to get him to sort of react to eating and drinking and pooping and weeing and all the usual things that we have to do. We have to be a little bit rough, but we actually have to make him wee. Come on, sweetie. All right, and we do that because it stimulates him to think, I need to go for a wee or a poo. You know, so top, oh, you don't like that too much, do you? And no, you don't like that too much. So here we go.
After a few days of 24-hour care, Oliver will hopefully be strong enough to be rehomed with a new family.
Test it on the back of your hand, it's a bit hot. It's very personal.
And Helen is desperate he makes it.
At the moment, it's me and this cat, nobody else. Well, I hope he survives and hope he goes on. It's lovely. Isn't that nice?
Thank you guys, we'll see you in a bit. Yeah?
Thank you.
Bye. 6 years old, she's eaten a staple, it's stuck in her mouth.
Why are you eating staples?
What? How? What? Where? How?
Ready, Gilsian, clinic number 5. That's ready to number 5.
I love my dogs.
Yeah, that's my guinea pig.
Oh, what have you got? I'm saying about yourself.
Guinea pig.
Oh, guinea pig. Oh, I can't see him.
In London, Katerina is waiting to see a vet because she's worried about her guinea pig, Noel. He seems to be uncharacteristically vocal.
Noel to clinic 3, please. Noel to clinic 3.
Lawrence is the vet who needs to figure out exactly what the noises might mean.
I'd say my job is probably 50% quite stressful and 50% super rewarding. It keeps you thinking and it keeps you moving. I mean, such a cliche, but every day is so different.
Hello.
Hi, how are you doing?
Very well, how are you?
Good, thanks.
I noticed he's squeaking when he's peeing and pooing.
Okay.
But today I heard this like I was sure something's wrong.
Guinea pigs can be chatty little things, but may make a lot more noise when they're in pain.
It's okay, baby, it's okay. It's okay.
All right, let's quick listen to his heart. Yeah. He's very chatty, isn't he?
Oh, he's like...
He's upset. The challenge is being able to examine them properly because the heart beats at a million miles an hour and they don't really show signs of being unwell, particularly until it's kind of the last minute.
It's true. It's okay.
Little Noel's squeaks could be a sign of bladder stones or vitamin deficiency. So for Lawrence, it's a process of elimination, and his first instinct is a surprising one.
So what we're looking at here is potentially a little bit of arthritis.
Arthritis.
Just like us, as they get older, guinea pigs can suffer from painful arthritis. And also, just like us, it can sometimes make them a bit grumpy.
I mean, generally it's a little bit of an older guinea pig, but that could be a possibility. So what I think we'll do is we'll try him on a week worth of painkiller, and we'll see if that improves anything, and then we'll see him back in a week's time. If during that week you're worried about him, if he stops urinating, if he stops eating, stops drinking, goes downhill, then bring him back sooner.
Okay, baby.
Right.
Okay, thank you.
He's not a happy bunny, is he? Well, happy guinea pig.
Down the corridor, Christina is still desperately trying to get to the bottom of Frank's bedwetting mystery. She has one more bit of tech to try to see if it can reveal what's going on.
Can't see anything at all in there.
Ultrasound.
Okay, so this is the bladder, this black area on the screen. I mean, there's nothing on the scan, nothing here that could cause his incontinence. And it's very strange that he is urinating when he sleeps, and then sometimes he just is incontinent. I mean, animals that are incontinent, they tend to be incontinent consistently.
Yeah.
I don't know if there is something else going on.
It's all booked in. No worries, we'll see you then. Bye-bye. Adam said to me the other day, should we train our cats to sit on the toilet?
You can do that,
No,
but you have
I
to
just
start by
yeah,
building
but
things up in the toilet for them to go through it.
Imagine getting up in the middle of the night and being like, oh, sorry, oh, sorry, babe.
I didn't realise this was occupied.
We know our own pets better than anyone. A few days after their first visit, Katerina is back at the Blue Cross hospital, worried about her guinea pig, Noel.
Noel Zokovat, Clinic 4. That's Noel Zokovat, Clinic 4.
I'm concerned. Just saw him like really trying to go to the toilet and crying in pain. Much worse than last time. I want to get him better. I don't want him to suffer, so, you know, very often apparently it's too late when they are very visible, the symptoms, so we have to catch as soon as possible.
Hello, come on in.
This time it's vet Maria who's taking a look.
How's Noel doing?
Worse.
Worse?
Yes.
Oh
yeah,
dear, okay.
Unfortunately.
So two things could be going on. So we could have either an orthopedic problem, or we could be having that plus a urinary problem. So guinea pigs are really good at getting bladder stones, and that's why we need to make sure we don't miss.
This,
Yeah. Just be aware that for doing something like this, we will need to give him a sedation / an anesthetic. And small furries, the anesthetic risk is a bit higher compared to a cat or a dog. Fingers crossed for him. All right?
Okay.
Cool.
Thank you so much.
You're welcome. No worries. Yeah. Speak to you soon. Bye.
Oh, come on in. Oh, it's all right.
These little creatures are 20 times more likely than a dog to suffer an anesthetic-related death.
I know. Good, Baba. I know.
So it's an anxious wait for Katerina.
He was with me since he was baby. 7 weeks, and now he's 2 years, so he's never been without his brother and without us. So I hope soon, very soon, we get him back home.
Surgery is something that can go quickly wrong, and something that you can do that you sometimes can never reverse. And when surgery is kind of done in an emergency situation, it is really, really stressful.
To keep time under anaesthetic short, Vet Lawrence and Nurse Haley have to work fast to find out what's going on.
Guinea pigs get a lot of sediment in their bladder, so you can see kind of like it being speckled. That would be normal, probably. I don't think I can see any. Can you turn that light on?
Yeah.
Time to get a urine sample to run more tests on.
There you go, Jess.
And the quickest way is to go direct to source using a needle.
Yeah.
But Noel isn't playing ball.
Oh, he's weighing too much.
Oh.
Nah, I lost it. I'm quite good at avoiding the messy moments. Other people have to change a couple of times a day where, I don't know, I think think maybe I'm just a bit of a princess when it comes to that. Should we just express it into there?
Yeah.
This is so undignified for him. Squeezing a guinea pig into a tube. I suppose we could send this off, couldn't we? This teeny amount.
Hey.
Whilst Noel's coming round post-op.
Hello, look. Hey, see?
Frank's struggling to rouse his 50 kilograms into action.
Doesn't want to get up. He's awake, he just doesn't want to get up. Good boy, come on. Let's go, Walkies, come on, come on. Come on, I know you're awake, you're just being lazy.
Vets' tests have failed to identify a physical cause for his incontinence, suggesting it could be neurological. So Christina calls the person who knows Frank best, owner Maria.
Hello. Oh, hi, hello there. Is that Miss Nash? I've been looking after Frank today, and we've just done some tests on his bladder, and there is nothing really wrong with his bladder. I don't know if there might be some type of neurological problem.
His front legs are quite shaky, the back legs are quite stiff, but like straight and kicking outwards.
Mm-hmm.
And then basically when he gets up, his bed is wet. Yeah.
I mean, just the way you are describing it to me, that sounds to me like it could be a fit, kind of similar to the ones we see on animals that have epilepsy.
Epilepsy is the most common neurological problem for dogs. Around 1 in 130 dogs have it. Dogs de Bordeaux are prone to it, often developing it between 6 months and 3 years old. But it can be difficult to be sure without expensive MRI scans.
We can try some epileptic tablets and see if the problem resolves. It's going to be a bit of a trial, because I guess from here the next step will be to refer you to a neurologist where they can maybe assess all the problems.
All right, and thank you.
Okay, take care. Bye-bye.
Bye.
Freddy, Gilsian clinic number 5, that's ready to number 5.
Has he been then?
Better.
Is he better?
Much better. Much better. I kept him...
In clinic, Katerina's back for a checkup with beloved guinea pig Noel.
He was very apathic and...
We did try to get a sample when he did come in, but then he just peed everything out, so we couldn't get a sample.
But he is showing signs of responding to medication.
He just wants to sleep.
The thing is, if he has responded to the antibiotics plus the pain relief, that we probably were dealing with an infection.
Yes.
Perhaps all along. Okay. Chances are he's probably still working to get over that. So what I would recommend is that we continue with the antibiotics a little bit longer and the pain relief. And with a lot of TLC, and I'm pretty sure that, if he spends time with his brother, if you guys spend time with him, I think he will slowly get back to his normal self, as long as we get this under control. My favorite thing about the job is being able to see an animal and do what I need to do, and then get them back to the owner a little bit better. Just that satisfaction of actually making a tangible change.
Thank you so much. Thank you. Bye. Bye, thank you.
After another week on antibiotics, Noel's back to his old self. In Grimsby too, there's another big result for a tiny animal. After 2 solid days of round-the-clock care, baby Oliver was moved to the Blue Cross Centre in Thirsk, from where he will be rehomed. And with the benefit of a few more days, the team have worked out Oliver is actually Olivia.
Good boy. Oh no, he's left me a package.
In London, the animal ambulance is back with plus-size patient Frank to see if epilepsy was the cause of his bedwetting.
Another week.
Stay. He's lost a bit of weight, but I'm not too worried because 200 grams is not much. It's probably the poo he's had this morning.
Yeah, you left that in the van for me.
Oh yeah, that's right.
Frank has been taking anti-epileptic medication, phenobarb, for a fortnight, and he seems to be responding.
She did sort of mention the shaking and all of that side of it stopped.
For his breed, they do tend to get fits. They do tend to get seizures. So I think we are dealing with exactly that.
Okay.
Yeah.
And Maria is happy that the drugs will also have a positive effect on Frank's bed sheets.
How much better was it?
He was still going, but I don't know how much.
Probably less, because to be honest, if it's associated with the fitting episodes, then it's all the same. Yeah, so that should be reducing as well. Okay. Hi, is this Mrs. Nash? I just saw Frank. The fact that he responded to it, to the phenobarb, means that there is some form of epileptic activity in his brain. So we can try a lower dose, because that might be good enough to control his fits.
Happily, Frank can be reunited with a grateful owner. She can't get to hospital to collect him, so that means another trip in the ambulance.
I love animals, and I love helping animals and making sure they're going to be all right. I always wanted to be a vet, and if I had to change my profession now, I'm not really sure what I would choose to do.
Oh, Frank, why?